Are all speech sound disorders articulation disorders? I'm Amy Graham, a speech language pathologist in Colorado, and I specialize in speech sound disorders. So when I was in the schools, and I was in the schools for a lot of years, we tended to use the term articulation to mean anything speech related. So if a child came to me with apraxia or phonological errors, we tended to use the term articulation. But articulation, for the purposes of clarity and just understanding what we're treating, is really a subtype of a speech sound disorder. So for clinical purposes, what I look at is the child distorting a sound? Is the motor precision of the particular sound just off? So these are kids with lisps, with lateral lisps, with R distortions, not the child who says wed for red, but they're saying lead. That tongue is just in the wrong spot. That I would call an articulation error. Kids who are consistently and in a patterned way, predictable way, substituting sounds and omitting sounds are typically, those are phonological errors. But we also have our kids with motor speech errors, like with apraxia, where it's not about sounds, it's about movement, or with dysarthria, where it's about weakness. So it's very important that we understand what is indeed going on, because you're going to treat all of those subtypes very differently, or at least you should if you want to be more effective quicker. If you are struggling identifying the difference between all of those subtypes of speech sound disorders, I have a 2-hour course called Cracking the Code: Differential Diagnosis of Speech Sound Disorders. You can find it in my link tree.